Well, I think that in these tough economic times, we need to look everywhere we can to save money and to find new sources of revenue. With regard to the probation department, I've been talking for a long time about the wasted millions that the state legislature has been sending there over the past several years. I'm pleased that Senator Cream wants to find money there. I'm disappointed that as recently as last year, she voted to override the governor's veto of spending at the probation department. The probation department is an example of a place where we can find lots of money available. We also need to be investing in smart economic development programs. I am not a supporter of the film tax credit, for example, because that Department of Revenue studies have shown that that's a money loser for the Commonwealth. We actually spend more money on every single job created in tax credits than those jobs create. So for me, that's a losing proposition. I want to be investing in small businesses to help create new jobs. We need to find some strong leadership to actually get some of these legislative proposals passed. Things like improving the permitting process for wind farms. If we can, I'm a big supporter of Cape Wind. I know it's a little controversial, but unless we're willing to think outside the box and push the envelope on alternatives to fossil fuels, we're not going to be able to either to drive economic growth or to get over our reliance on fossil fuels that are causing tragedies like in the Gulf oil situation. We should have been able to pass a bill to make it easier for these types of businesses to expand in Massachusetts. It's something else the legislature wasn't able to do. So we have lots of opportunities to promote smart growth, to find waste, and to pass legislation like the bottle bill, which is another example of something that at the end of the legislative session was left unfinished while the legislators adjourned for the year. So I think that we need to be creative, we need some new leadership, and we need to look to the future to solve the tough economic challenges we face.
1 minute, Rebecca.
Well, the kinds of credits that I would vote for are the kinds of credits that are tied to jobs, because we can't keep giving away money and not have them tied to jobs. We gave Boston Scientific a tax credit. Actually, my opponent was there, and they didn't provide the jobs, and this year they came back for more tax credit, and we denied them. What's important is that we continue to give tax credits. Now, on the film tax credit, University of Massachusetts did a study, and the study that the Department of Revenue did not consider all the money that we got from the surrounding businesses, the hairdressers, the barbers, all the people that are working, the restaurants, as a result of these wonderful films that are being made in Massachusetts. That's what's important. You have to look at everything. You can't just look at little pieces. You have to be experienced and look at everything. Thank you.
Okay, now that we've resolved the economy, we're moving on okay, to health care. So, Charles, you get this question first. And the question is, Massachusetts enacted a groundbreaking health care law a few years ago, but now health care costs are increasing. What are your ideas for maintaining coverage for the 97% of Massachusetts residents who now have health insurance?
That's a great question, Cindy. And one of the centerpieces of my campaign has been talking about the soaring costs of health care and how we need to get them under control. As you say, Massachusetts led the nation in expanding coverage. The federal law that was passed was based largely on our model. As you said, we have close to 98% of our citizens now have access to health care coverage. But the rising costs of health care, we are crippling small businesses, they're crippling municipalities, and they're crippling household budgets. We need to be able to find a solution to this, and I have proposed making this a top priority if elected to the Senate. I applaud the legislature in some respects because they passed a bill at the end of this session that provided some relief to small businesses and some other incremental changes. But even the chair of the committee that passed it said it was just a first step, and I fully agree with that. We need to take a look at the fundamental problems that are driving the premiums to go up in the first place. We can't look simply at Band-Aid approaches or short-term political fixes that would simply provide a one-time relief for premiums, for example. We need to understand the incentives doctors have under the current system, which are primarily to prescribe lots of tests and put people in critical care facilities after they get sick. We don't have the proper incentives in place to prevent people from getting sick in the first place. We need to be promoting wellness programs and greater access to primary care physicians. We need to be looking at some of these long-term solutions that have no easy or short-term fix. I was disappointed that the Senate President a couple of weeks ago announced that some of the more structural, difficult problems facing the issue of healthcare costs would be postponed to next year. And some of the reasons she cited were that it was too complex and too difficult to squeeze in at the end of a legislative session. Well, first of all, the legislative session did not have to end. We could have stayed in place to address it. But because it's complicated, because there's no easy answer, I think that's why we should be throwing our arms around it and trying to figure out the answers now. You know, Senator Crean made an allusion to tax breaks that Boston Scientific received. I, am no longer at Boston Scientific. I can't speak on behalf of them, but they make terrific products that help improve people's lives. They help improve and save people's lives. And my 7 years of experience there gave me, I think, some unique insights into the healthcare delivery system. I also had some unique insights that I've learned from when our infant daughter required open heart surgery at age 3 months. And thank goodness she turned out okay. But this has led me to understand the miracles possible under our healthcare delivery system if you have access to quality, affordable insurance. And that's why I want to make it a top priority if I'm elected as your state senator.
Don't take it from my time, but okay.
Thank you.
I've actually voted on a bill to begin the process of helping healthcare costs. I'm not talking about it, I've done it. We passed a bill at the end of the session, and I'm glad that you acknowledge it was a great bill. We dealt with small businesses. We brought the costs down to small businesses. We allowed people who get their insurance from small businesses to collaborate, to go through Mass Municipal Association and bring their costs down. We have a pilot program that we just initiated for small businesses. We've taken a look at how the companies charge, what they charge, and what their premiums are based on. And if there's an increase in the health insurance premium, these companies have to prove to us what percentage are services and what percentage are administrative costs. We've taken a look at that. We've had a bad problem in people coming in and out of the healthcare system. We changed that by a bill that we did, and I'm proud to have voted on it this year in the session as it ended. And that would say that there is an open enrollment. And unless you have a specific reason, you must enroll in the open enrollment. So we would prevent you from coming in and out of the system every time you needed some health care service. This was a groundbreaking legislation. We were asked to do this by the businesses, and I'm pleased that the Senate did this. Now, the next step, and I have to say that leadership is bringing people together. Leadership is building consensus. And there have been many people who have tried to fix the health care plan. But we in the legislature have been meeting with people and hearing their ideas and building upon that consensus. And I'm the kind of leader that will bring people together and find consensus, not to get a quick fix because somebody thinks it's a good idea. Thank you.
I don't think I was suggesting in any way that we're looking for a quick fix. Completely the opposite. I was suggesting that because there is no quick fix, we need to focus on it now. We need to make it a priority now, not to wait till next year. And I think what's interesting is Senator Cream talks about leadership. My view of leadership, I agree. You need to pull people together. You need to talk about and understand the issue, but you actually need to get results. And that's what I think we're missing. We don't have a solution to the health care problem. Senator Cream talks a lot about supporting a bill or voting for a bill or introducing a bill. What I'm suggesting is we need stronger leadership, more effective leadership, full-time leadership to actually turn those bills into law. Whether it's the bottle bill, the gun control bill, alimony reform, cleaning up the probation department, or health care, I'm suggesting that simply being the voice or supporting the effort isn't getting us the results we need, and that's why I'm running for state senate.